Okay, so hey guys, how's it going? So, as I mentioned in some of my previous videos, I'm a recent graduate of a Master of Science in Medical Physics, and I'm transitioning into a doctoral degree in Medical Physics. Now, a lot of the times, if I'm out in the public and I'm talking to someone, I often get asked, "Okay, what is it? What exactly is it that you study?" And I answer medical physics, and then quickly after, what is medical physics? So because of this, I thought I think it would be a good idea to create a general video focused on explaining what exactly it is that a medical physicist does. And I think I'm going to focus it towards perhaps a prospective student for medical physics, or even just a member of the general public. Okay, so right off the bat, it's interesting to note that medical physics is difficult to explain. If you look at the occupational details, you're going to see many words used that are classified as jargon, which are field-specific words. Some examples that you will hear a lot of, some examples of jargon-type words that you hear a lot of, are commissioning, validation, acceptance testing, quality assurance, things like that. So I'm going to try my best to give an occupational description in as layman's terms as I can. It is relatively difficult. Okay, so first off, I'd like to mention that realistically there are 4 different branches within medical physics. So I'll talk a little bit about each one in brief. I'll try and give you guys an idea as to how many are in each group. Okay, so the first medical physics branch is called the radiation therapy physicist. This is the largest group. They make up approximately 3/4 of all medical physicists, but this is excluding non-clinical medical physicists. These are going to be medical physicists who they primarily work in a hospital setting, but specifically where they work is in an oncology department. This is the branch that I'm focused on. This is the branch that I'm primarily getting trained for. So this is the one I'll be talking about the most in this video. But let me get to the other branches of medical physics. Okay, so secondly, the second largest branch of medical physics, excluding non-clinical, is diagnostic medical physics. These are going to be medical physicists who work primarily with the functions revolving around either imaging procedures or the actual imaging machines themselves. So because they work with imaging, they're not as inclined to stay in one department because there are imaging devices in many other departments. There are imaging devices used in radiation oncology, but there are imaging devices used in many other departments, so they're going to be moving around quite a bit more. Also, there are there are radiation-based imaging devices in locations that are not in a hospital. For example, a good example would be at a dentist's office. The dentist office uses an X-ray machine, but it is not in a hospital. Okay, so the third main branch of medical physics is the nuclear medicine physicist. So these physicists aren't as common, but they work primarily with live radioactive sources. They can be either used for therapeutic reasons. So in radiation oncology, we use a live radioactive source for a type of treatment. It's called brachytherapy. Also, we use live radioactive sources for imaging procedures. An example of this would be PET, or positron emission tomography. Now, the fourth branch of medical physicists is they're medical physicists who do not primarily work in a clinical environment. So I call them non-clinical medical physicists. They're typically called non-clinical medical physicists. Now, it is a bit difficult to gauge what percentage works in non-clinical occupations because there are many varieties. There are many different areas to go. I'll talk a little bit about some examples. So one example might be a non-clinical medical physicist might work for a regulatory agency, like, for example, the NRC, the Nuclear Regulatory Commission, which is within the federal government of the United States of America. They may also be employed in the industry, producing some kind of medical equipment. The market is multi-billion-dollar market producing medical equipment, so they may be employed in that area. They may also be employed as a health physicist. The health physicist specializes in personnel radiation safety. A common example where you're going to find health physicists are going to be in a nuclear reactor. They may also be employed as researchers. Now, this is sort of a pseudo clinical occupation. That is, they may be employed for a consultant company. Now, what a consultant company does primarily is that, okay, let's say there was a facility that required some kind of, let's say, quality assurance test or task to be performed on a piece of equipment, but there isn't enough work that would require the use of a full-time physicist. So in that case, they may hire out a consultant company. The consultant company will send a medical physicist out to perform that particular task. Okay, so those are the branches of medical physics, but the largest group is the radiation therapy physicists. That's a group I'm going to be talking about today. That's the group that I'm going for, and that's the one I'm getting trained for. So let me talk a little bit about the job details of a radiation therapy physicist. From now on, I will be calling them RT physicists, because I'll be saying it a lot. Also, in my videos, I'm going to try to incorporate subtitles so it's easier to flow through the ideas. Okay. So the first job detail is the RT physicist is responsible for the acceptance testing and commissioning of all new equipment brought into the radiation oncology department. So the equipment could be a linear accelerator, an imaging device, treatment planning software, immobilization devices, could be dose measurement devices. There could be lots of different possibilities. Now, I use some jargon terms there. I use acceptance testing and commissioning. So let me talk a little bit about each one. So what is acceptance testing? So acceptance testing is when an oncology department purchases a piece of equipment, often a very expensive piece of equipment. Now, acceptance tests are performed on this piece of equipment. They're basically a large number of tests that the physicist will perform to basically check the integrity of that piece of equipment, to make sure that all the specifications that piece of equipment is supposed to have are actually where they're at. So a lot of the time, the medical physicist, they often will work with a service engineer from that piece of equipment as it's being installed, and they'll be performing the test as it's being installed. So if there is a problem, it can be alleviated as fast as possible. Now, the second jargon term I used is commissioning. So basically what commissioning is when a medical physicist performs a large amount of tests on a piece of new equipment. And when you're performing these tests, you are determining basically valuable data. You're determining valuable data when you're performing a large number of these tests. Also, in this valuable data and information, this data can be used for the clinical when it's time for it to be in clinical operation, a lot of this data needs to be used. Also, when you're performing a large number of tests, within commissioning, the physicists, they're determining like baseline values for each of these tests. So, in the future, in a year from now, 2 years from now, they can look at that particular value for that test and can compare it to what it initially was within the commissioning. I hope that was a good description. Okay, so the second job detail is going to be the medical physicist develops and maintains a quality assurance program for all of these different devices. So quality assurance for linear accelerators, mobilization devices, treatment planning software, imaging devices, and all additional devices. For example, dose measurement devices. Some of these devices may require what is called calibration. So what's calibration? The definition basically of calibration is that it's the comparison of a measurement, like of a test, with that of either a standard measurement or a measurement from another device. So like a linear accelerator needs to be calibrated with respect to a standard measurement. So all of these different devices require quality assurance tests that have to be performed on them. And now, these tests have to be performed typically at intervals of daily, every day. So quality assurance tests have to be performed every day, daily, monthly, and annually. So, because of that, because they have to be performed with such frequency, you can imagine that a medical physicist is going to be spending a great deal of time performing these quality assurance tests, because there's lots of equipment too. Okay, so the third job detail of a RT physicist is going to be they will act as a technical resource for the radiation oncology team. So because the RT physicist performs all the they perform the commissioning and acceptance testing, they perform a lot of the initial tests. They are regarded a lot of times as a technical expert within the department. So because of this, a lot of the times the physicist has to be available, just in case anyone needs help with any of the pieces of equipment within the department, if any problems were to arise. Some examples, I'll just give some examples. Let's say a therapist is treating on the linear accelerator, they run into a particular fault. They may call they should call a physicist. A physicist will go out there and take a look at it. Let's say a dosimetrist, they typically make the treatment plans. Let's say the software that they're using just had a patch. And they have some questions about the patch. They're going to call a physicist. The physicist is going to go out there and work them through it. Okay, so the fourth job detail of a medical physicist is that they have to understand the limitations and appropriate use of the radiation therapy treatment planning software, and then kind of running with that, the entire radiation therapy treatment process. So the radiation therapy treatment planning software is very complex. Basically, it uses many different, they're basically dose calculation algorithms, dose calculation methods to calculate the patient dose. And they may be more accurate in certain circumstances as compared to in other incidences. So the accuracy, it depends a lot on that particular case. It depends on, say, for example, like the geometry used for the treatment. the overall accuracy of the patient-generated image, which was initially typically from a CT scan. So it's a big part of the physicist's job to basically understand the radiation therapy treatment planning software and understand the limitations, of when to use which with respect to a particular plan. I'm kind of running with that. It's the RT physicist's job to understand basically the entire radiation therapy process. The particulars as to when a certain thing should be used and when, in the circumstance, that it should not. The overall accuracy of the created radiation therapy treatment plan. So, finally there, I'll just say that basically everything in radiation therapy in the treatment process has a particular accuracy to it. The physicist should know the limitations of the entire process. So also, another thing the physicist performs, because the treatment plans can have very complex dose calculations. Dose distribution is the term we give, but can be hard to understand. The dose calculated, created in the software. We perform something called IMRT-QA. This is where we actually take the radiation therapy plan, we bring it out to we send it out to the linear accelerator, and we actually measure it with a dose measurement device. And by this way, we're able to tell, if the complex doses in that particular plan made in the software, if they're calculated accurately. Okay, so the fifth job detail is going to be the RT physicist consults and participates with the radiation oncologist and the other team members in implementing the immobilization repositioning system for the patient. So, because the physicist is regarded as the technical expert within the department, they perform a lot of the initial tests, and the physicist is aware of the accuracy and limitations of the entire process. They're going to help with deciding upon what type of devices are going to be used for the particular setup for a treatment. They're also going to observe the initial radiation setup for radiation therapy treatment, and they're going to have a role in deciding which equipment is best used for that particular kind of treatment. Okay, so the sixth RT physicist job detail is going to be the radiation physicists. They perform checks over the developed radiation therapy plan. So basically, the RT physicists they perform what are called chart checks, which they basically look over all of the aspects of a created plan. They're looking over all of the plan parameters, just the design of the plan, all of the coordinates of the plan. They also have a secondary software, and they'll perform what's called a secondary dose calculation within that secondary software. Basically, to see if the dose is calculated accurately. And if they like the plan, they sign off on it. They agree that it is an acceptable radiation therapy plan. Okay, so the seventh job detail that an RT physicist will perform is the radiation therapy physicist, is in charge of taking the dose measurements in the event that it's requested to do so. So the physicist is the oncology team member primarily trained in measuring dose. So there are a lot of different kinds of dose measuring equipment, and basically there are a lot of different kinds of dose measuring products of the different kinds of equipment. out there on the market, and new products coming out all the time. So it's the responsibility of the physicist to be well versed in all the different dose measuring equipment and also the products. Okay, so the eighth RT physicist job detail is going to be that the physicist often works on research experiments while they're performing clinical duties. Okay, so if you look at healthcare within the past, let's say 100 years, and you ask, what particular aspect within modern day healthcare has made the most significant impact? I think probably without a doubt you're going to say it's the routine use of 3D imaging devices, particularly MRI and CT imaging. Now, the medical physicist created these imaging devices, these 3D imaging devices, and not only did we create them, but we also perform a lot of research on them so that we can fine-tune the use of them in modern-day healthcare. And also, we created new techniques for when to use them. Now, I just mentioned CT imaging and MRI, but also medical physicists have created many different healthcare devices, imaging devices, technologies, basically all different kinds of healthcare-related devices, from the very large product like MRI and CT down to the very small. So, because of this, it's important to note that research is a very big part of medical physicists. Also, we're regarded as the technological experts. So it's very important that a physicist is well versed, of course, with all clinical duties, but also with the different aspects of research within the healthcare field. Okay, so the last job detail I have, job detail number 9, is that the medical physicist often has a role in education. So, there are many big oncology departments out there that employ many physicists who are directly combined with a university. So because of this, a medical physicist may be required to either teach a course or have some kind of role in education, perhaps clinical teaching or something with respect to the university setting. But also, let's say a medical physicist is employed by a healthcare facility that isn't attached to a university setting, they're still going to have a role in education. Because they're regarded as the technical expert within an oncology department, there's a lot of teaching going on, within that, within the healthcare facility, with respect to different pieces of equipment, how to operate them appropriately, things like that. So the medical physicist may also perform like educational in-house sessions for the healthcare facility. It could be on a number of, any topic, but a common topic could be radiation safety with respect to using any of the imaging devices. Okay, so that is the 9 job details with respect to what a RT physicists would normally perform within their occupation. By all means, that is not an extensive list. I think it's one of those fields where, if I actually sat there and, I wrote down every job detail, I would just be, reading off the list, and there would be, some huge amount of jobs, like 200 job details or something along those lines. So I just gave a brief overview of what the RT physicist would perform. So me personally, I graduated from a Master of Science in Medical Physics. I'm transitioning into a doctoral degree. So for any prospective students out there, I absolutely love the field. It's never a dull moment. And I get to work with arguably the most technologically advanced equipment out there, arguably. So, maybe like an astro engineer or something might be comparable. But so I get to work with very advanced technology, and hopefully with a doctoral degree, I'll get the opportunity to even innovate upon some of it. So with that, hope you found my occupational description of medical physicist simple to understand, but also clear in detail. I'd like to thank you for viewing. If you like the material and content, please feel free to like it on the YouTube channel. And thank you. Bye.